Cherubism is also known as familial fibrous dysplasia of the jaw, disseminated juvenile fibrous dysplasia, familial multilocular cystic disease of the jaw, hereditary fibrous dysplasia of the jaw. These are the terms used for cherubism, but these are the terms are related to fibrous dysplasia, but there is no similarity between the fibrous dysplasia and the cherubism. So these terms should be avoided. So Jones, the first described by Jones in 1933, he coined the term cherubism, the reflecting the characteristic of chubby facial appearance similar to plump-cheeked little angel called cherubs, seen in Renaissance painting. So he called the condition called cherubism. So it is a autosomal dominant inherited fibro-osseous disease that affect only the jaw, causing bony expansion. So it only affecting the jaws. The classification, it has 3 classification: grade 1, grade 2 and grade 3. The grade 1 is the fibro-osseous expansion tend to be bilateral and symmetrical, and it is primarily in the ramus of the mandible. So in grade 1 it only affect the ramus of the mandible, and grade 2, in more severe cases, the ramus of the mandible and body of the mandible are involved, resulting in congenital absence of third and occasionally second molar teeth. So in this group, the tuberosity region of the maxilla is also affected. So in grade 2, there is affected of ramus of the mandible, body of the mandible and maxillary tuberosity are affected. And grade 3, lesions affect the mandible and maxilla entirely, so may result in considerable facial deformity. So next, moving on to etiology, the first etiological factor is developmental defect. So the anomalous development of dental structures with disturbance in the development of the bone forming mesenchyme may lead to this condition. So developmental defect, so it is a developmental defect, anomalous development of dental structure with disturbance in the development of the bone forming this condition. And the next reason is hormonal. The cherubism can be present in latent hyperparathyroidism and hormone dependent benign neoplasm, and other reasons are trauma and aberration in ossification. Next, moving on to clinical features, the first one is age. It affects the 2 and 4 years child, and it is most commonly affect male predilection than the females. And sight, it shows predilection of angle of mandible and bilaterally and occasionally posterior maxilla. So it mostly affect the angle of the mandible and occasionally it affect the posterior part of the maxilla, that is maxillary tuberosity. And the appearance, in the rapidly increasing stage, the child assume chubby cherubic facial appearance. So it is very important, chubby cherubic facial appearance. So especially if combined with involvement of the orbital floor with upward displacement of the globe and exposure of the scleral rims. So this appearance result due to bilateral involvement of the posterior mandible. Next, moving on to the symptoms, the patient may have difficulty in speech, deglutition and mastication, respiration and limited jaw movement. So what is deglutition? That is swallowing difficulty. So the difficulty in speech, deglutition, mastication, respiration and limited jaw movement. And the signs, what are the signs for cherubism? Swelling is firm and hard on palpation because it is a bony expansion, so it is hard. And overlaying mucosa is intact and it is not painful. So there is no pain in the case of cherubism. And moving on to the jaws. In jaws, there is bilateral enlargement of the mandible. In this condition, it produces the full round lower face. So bilateral enlargement of the maxilla gradually follows. First, there is bilateral enlargement of the mandible and follows bilateral enlargement of the maxilla. So eyes raised to heaven appearance. It is very important in the case of cherubism, eyes raised to heaven appearance. So there is pulling or stretching of the skin of the cheek depresses the lower eyelid, exposing the thin line of the sclera and resulting in the condition called eyes raised to heaven look. So it is very important. Eyes raised to heaven look. It is seen in the cherubism patient. Why it is seen? There is a pulling or stretching of the skin of the cheek and depresses the lower eyelid. And next, this picture showing the patient having eye raised to heaven appearance, and there is enlargement of the lower face. This is the classical example of cherubism patient. And next, moving on to orbital floor, there is tumor encroachment on the orbital floor often causes partial obliteration of the palatal vault with resulting V-shaped cleft. So there is a V-shaped cleft in the palatal vault and tumor encroachment on the orbital floor. An alveolar process, the alveolar process are so wide as to occupy almost whole of the roof of the mouth. So the actual palate being reduced, there is a narrow palate because the alveolar process come together. So there is a between two approximating alveolar process, it reduced to a narrow fissure, and it is lymph node. Next feature is lymph node. In lymph node, there is a enlargement of the submandibular lymph nodes. It is very important. There is enlargement of the submandibular lymph nodes and progress. There is a rapid increase in size up to 7 to 8 years of age. So after which the lesion becomes static or progress very slowly until puberty. Until puberty, there is slow progressive. After puberty, the maxillary lesions tend to regress. So the mandibular lesions progress slowly up to the age of 20 years and then regress. So the facial appearance almost return to normal in the 4th and 5th decades of life. In teeth, the fibrous replacement of bone displaces the deciduous dentition. So the primary teeth may be irregularly spaced and may be absent. There is a premature loss of primary teeth. So the developing permanent teeth are affected, it giving rise to displaced, unerupted or absent teeth along with malocclusion. So the cherubism patient having lots of unerupted teeth. So these are the clinical features of cherubism. So the developing permanent teeth are also affected in this condition. Next, moving on to the radiographic features. First one is radiodensity. It is a cyst-like radiolucency of the mandible. Bilaterally symmetrical, which is up to several centimeters in diameter. So in mandible, there is cyst-like radiolucency is present. And progress initiation of the bone destruction near the angle of the mandible, and later it expand the lesions posteriorly into the ramus and anteriorly into the mandibular body. So initially it starts at the angle of the mandible and then progress posteriorly into the ramus and anteriorly into the mandibular body. An appearance, it appears as a classic multilocular cavity due to internal radioopic septa, so which tends to collapse as they enlarge. So on posterior anterior views, teeth are to be hanging in air. So floating tooth appearance. So it's very important, floating tooth appearance. So the teeth are to be hanging in air because there is loss of bone. And margins, they are well defined and well corticated and smooth around the most of the radiolucency. So margins are well defined. And the effect on surrounding structure, there is also expansion of the buccal and lingual cortical plates. So expansion of buccal and lingual cortical plates are also present, and in mandible, the inferior alveolar canal may be displaced and the lesion may occupy alveolar process, the angle and the ramus. So the thin cortex may eventually disappear. Maxillary lesions enlarge at the expense of the maxillary sinus. In mandible, there is involvement of the buccal and lingual cortical plate, and inferior alveolar canal may be displaced due to this expansion, and in maxilla the lesion is enlarged and involving the maxillary sinus also. And the effect on the teeth, displacement of the numerous teeth but prior to enamel calcification. So the erupted deciduous teeth in the area of bone, involvement of shed prematurely. The erupted deciduous teeth in the area is fall before the permanent teeth the time has to be changed because of the premature shedding of the deciduous teeth. So the few posterior may be missing due to the early developing expanding mosses. It destroy the buds and incipient follicles. So this picture showing the radiographic appearance of the cherubism patient. There is a lot of impacted teeth in the maxilla and the mandible. So teeth are floating tooth appearance. So there is a lot of multilocular cyst also. So it mostly affect the both maxilla and mandible and bilaterally symmetrical. And next, moving on to diagnosis. The first one is clinical diagnosis. Typical cherubic appearance of the child with bilateral swelling in the jaw. So there is bilateral swelling in the jaw and there is only affecting the jaw. And radiological diagnosis, the cyst-like radiolucency present bilateral in the mandible. Most commonly it affects the angle of the mandible, then ramus and body of the mandible, and also affecting the posterior part of the maxilla also. And laboratory diagnosis, in active cases serum alkaline level may be raised. So in active cases serum alkaline levels may be raised, and biopsy shows large multinucleated giant cell in loose delicate fibrillar connective tissue stroma. There is a multinucleated giant cells are present. This is a classical feature of cherubism. So there is presence of multinucleated giant cells. So this picture showing the multinucleated giant cells in the connective tissue fibrous stroma. There is a presence of multinucleated giant cells. Next, moving on to the differential diagnosis. Here the first one is fibrous dysplasia. In fibrous dysplasia that is unilateral, and cherubism it is bilateral. And giant cell granuloma, it occurs frequently in the anterior segment of the mandible, but in cherubism it is most commonly involving the posterior part of the maxilla and mandible. And central hemangioma, it is localized gingival bleeding and pumping tooth syndrome. So in central hemangioma there is localized gingival bleeding is present. And giant cell lesions of the hyperthyroidism, they are not bilateral and they can be differentiated on abnormal blood chemistry level because of hyperthyroidism. And next, moving on to metastatic tumor, it is seen in older age group as compared to the cherubism because it is affecting the children. And also there will be signs and symptoms or history of primary tumor elsewhere in the body. In metastatic tumor, there is primary tumor elsewhere in the body. And ameloblastoma, it is seen unilaterally and frequently in an older age group. And odontogenic myxoma, it has a history of missing tooth as it is of developmental origin. And nevoid basal cell carcinoma, no facial swelling is seen in the cherubism. So there are characteristic cutaneous abnormalities of or rib anomalies seen on the chest radiograph. But in cherubism, it only affecting the jaw. In nevoid basal cell carcinoma, it is also affecting the rib. And multiple dentigerous cyst, there is a definitely impacted teeth are present. But in cherubism, there is impacted teeth also present, may or not be present. So these are the differential diagnosis. So the main differential diagnosis is fibrous dysplasia. Fibrous dysplasia is affecting mostly unilateral, but in cherubism is affecting the both side of the mandible and maxilla. And giant cell granuloma, it is affecting only the anterior segment of the mandible. So next, moving on to management, the surgical contouring. The surgical procedure should be delayed as long as possible because the cystic lesion defect usually becomes static and regress during the adulthood. So surgical contouring of the lesions is necessary to improve aesthetics and in the case of active growth. And homogeneous bone graft, in the case of extensive involvement, homogeneous bone graft can be given to prevent the pathological fracture of the mandible. And orthodontic care, it required for ensure the proper alignment of the teeth. And the calcitonin, this therapy is under trial nowadays, so awaiting result of some study. So there is no treatment for absolute treatment for cherubism. If we do surgical contouring, we have to wait for crossing the adult growth. In case of there is active growth and improve the improper aesthetics, then we go for surgical contouring for improve the aesthetics. And homogeneous bone grafting, it prevents the pathological fracture of the mandible. And orthodontic care, it is also required to ensure the proper alignment of the teeth. So the important points of cherubism, what are the other names of cherubism and heaven to